the last session for today, but it's very important, medical. And as you all are aware, to enter into this stream is very hard, but once you through from this stream, then it will make very big difference for you as well as a society also. And today we have a big panel for our medical session. First of all, I'll invite a chairperson of this session, Dr. Hani Savla, to come on dais. Please give a round of applause for all these panelists. Thereafter, I'll call. Have a seat. Thereafter, I'll call Dr. Nidhi Maru. Please come on dais. Now I'll invite Dr. Kinjal Rambia to come on a dais, followed by Parmi Dedia Gala. Then I request Dr. Dhara Dedia, followed by Dr. Seema Vora. I request Dr. Priyal Gala to come on dais, followed by Dr. Kinnari Kenya, and finally I'll call Dr. Manali Visaria to come on a dais. So you can see now how big the panelists are there, and it shows that how important this session is. So I request all.
Please keep silence. એક યાદ રાખજો, સામે બધા ડોક્ટર બેઠા છે. અગર એમનું મૂડ ખરાબ થયું તો કોઈ જમી નહીં શકે. જમવું છે કે નથી? They are great doctors. એક તો બિઝી શેડ્યુલ હોય છે, બિઝી શેડ્યુલમાંથી પોતાનો ટાઈમ કાઢીને આવે છે just to give back to the society. So let's appreciate them and let's hear from them. Please, થોડું સાયલેન્ટ રાખો યાર. Please.
To start with, I'll just give a brief introduction of our chairperson, Dr. Hani Savla. She is an internal medicine specialist and have a special interest in treating diabetes, thyroid disease, and infectious diseases. Sorry. She is conducting regular lecture for physicians and postgraduate residents. She is a faculty at Wockhardt Hospitals to develop and deliver a series of education program on diabetes to physicians and nurses. She got certified training from the Royal College of Physicians for diabetes in special situations and comorbidities. And with this, I present you Dr. Hani Savla. I'll request Dr. Hani Savla to take forward.
Thank you so much for the kind introduction. So we come towards this last part, I think, of the career counseling seminar. And let me ask the question which many of us ask every year. How many of you are aspiring to go into medical profession out of the people here? Good numbers still, I would say. Little encouraging as compared to last year. So today, actually, we have got a very huge panel, and the reason behind this is because in last decade, medical profession has changed a bit. And we want to introduce those changes of medical profession to you in addition to what we know about doctors. So talking about this today, before I start anything, I want to remember my mentor who was in this place 1 year back, and I really miss his presence, late Dr. Praful Gadda, who held the vision to see more and more Kutchi KVO students in medical field. And today I'm here walking on his footsteps to complete or maybe to take this mission forward. And today is a day when we as medical professionals are here to clear all your doubts about this field. So medical profession was known to be a noble profession, which it is definitely today, for healing, touching lives, saving lives. But there is more to it today. With the medical field, there are new innovations where you can actually become a teacher. You can have two noble professions at one time. You can be a professor and a doctor. Second thing is you can take the leadership role and get into medical administration, which is a real upcoming field right now. You can even become a YouTuber or an Instagram influencer and actually pass authentic information with your degree and knowledge, because there is a lot of fake information on the internet and a lot of doctors have taken up this job of being a YouTuber. You can get into research and be the person who is instrumental in getting new vaccines, new medications, and newer therapies in medical care. So medical profession is not just about treating patients in the hospital. There are a lot other things which are coming up in which you can choose how many days you want to work, how many hours you want to work, and have a good balance of family life, financial life, and fitness. So these are the new options which has come with medical field, and I present to you an expert panel who is going to actually talk about each of this with you. And of course we have one-to-one session where you can clear the doubts post lunch. So without any wastage of time, let me first introduce the speaker who is going to talk about MBBS, which is the known degree in the medical field. Whenever you talk about medical field, the first thing that comes to your mind is MBBS. So how do you get into MBBS will be very well narrated by a second year MBBS student from St. GS Medical College in KM Hospital, Dr. Nidhi Maru, who has appeared in NEET in 2022 and has scored 658 in the exam with a AIR, All India rank of 3000. This rank of 3000 is amongst 50,000 students. Big clap of applause, big round of applause for Nidhi for achieving this. And we hope you achieve more in future. So Nidhi, take over the stage. Yeah, go ahead and speak about MBBS.
Thank you, ma'am, for the kind introduction. So, NEET, National Eligibility Cum Entrance Test, a gateway to most of the medical degrees out there. The eligibility criteria for NEET, as mentioned there, 1, 2, 3 peculiar I would like to mention is there are only 3 attempts allowed for NEET, and there is no age limit for NEET. So currently when I'm studying in my batch, there are a 40-year-old batchmate who is pursuing MBBS at present. These are the number of courses to which NEET opens the door. Now to understand the NEET exam pattern. Exam mode is pen and paper, duration 3 hours 20 minutes, 200 minutes for 200 questions. NEET is, the medium in which you can appear for NEET is as mentioned there, so you can even appear in your local language. Total questions are 200 and out of which 180 are to be attempted. Total marks 720, subjects physics, chem and bio, out of which bio accounts for 50% of the score, that is 360 marks, and physics 180, chemistry 180. Marking system, there is negative marking, so +4 for correct and -1 for incorrect answer. So in every subject, biology is divided into zoo and botany. So in every subject, there is section A and section B. Section A has 35 questions which are compulsory to be attempted, and section B has 15 questions out of which you have choice. So you can leave 5 questions. 10 questions are to be attempted, totaling to 45 questions to be attempted in all. So each subject has botany, zoo, physics, chem have 50 questions and total marks of 180. How to prepare for NEET exam? Very difficult question, but the major way is to study, understand concepts, and then is to apply the concepts by practicing questions. And after you have practiced the questions, practice n number of questions as they are given in the textbooks and the reference books, so that you can understand the twisters the examiner can put in, or the different way the examiner looks into the concept and asks questions. And after that, practice the previous year questions of the NEET, PYQs of the NEET, and the other entrance exams, and revise it again and again so that you are clear. Maintaining your mental and physical health are also a major aspect for preparing NEET exam, and having a positive mindset and dedication. That is also very important. My personal experience would say that I prepared short notes that helped me gain confidence over the subject. कि हाँ बनाए हुए notes हाँ एटले मुके अच्छे तो. And it helped me revise also effectively. And also keeping no backlog. A concept taught that day must be cleared that day itself. If you keep backlog, it would be very difficult to cover it later on. અને નીટમાં જેટલા બી મુજા ક્વેશ્ચન્સ રોંગ વે હું બેકલોગ વાળે ટોપિકથી જ વ્યાઈ રોંગ. So better not keep backlogs. Syllabus for NEET is basically NCERT textbooks 11th and 12th of science, physics, chem and bio. NEET is very basic, as in physics and chem je atle depth mein nata vane. It is all NCERT based. So practicing JEE and JEE advanced level questions for physics and chem is not necessary for preparing for NEET, but practicing basic NCERT level question, NCERT je pachal ja questions is very important for cracking NEET. Add a poster ke nere newspaper, बस बिलबोर्ड्स वो जो को सेंटर में नंबर देखा जाए तो AIR नेसेसरी फॉर ब्रीदिंग एंड नेसेसरी फॉर गेटिंग सीट. ऑल इंडिया रैंक मणे कोचिंग इंस्टिट्यूट हैव रीच पब्लिश कहिए, बट ऑल इंडिया रैंक इज वेरी नेसेसरी. आंजो कटलो रैंक अचे तो टू गेन सीट इन एनी ऑफ द कोर्सेस. Let's see the statistics. So this is the depressing part. So there are around 1 lakh seats for MBBS in 706 medical colleges all over India, out of which 55,000 are government medical college and remaining seats are in private medical college. This year, over 25 lakh students have applied for NEET, out of which, and in general category, the seats are even limited. So the percentage of students getting admission in government college is 2.2%. If you consider general category percentage, the percentage goes even down. So to get seat in MBBS, approximately your AIR should be 40,000 and above, and a score of 600 and above to, in particular of MBBS. So counseling post NEET, so there are two counseling that happen. One is state counseling and one is all India counseling. So in every state government college, if we say there are 100 seats, so 15 seats are reserved for all India quota. So students from all over India apply for those 15% of the seats. And the rest 85% of the seats are left for the state quota, state merit list के हिसाब से उधर seats मिलते हैं. And the colleges which are under central government like AIMS, JIPMER, their all seats are given through all India rank, all India quota counseling. 1 mark difference can drop your rank from hundreds to thousands. So the competition is very high. Cutoff per se to getting into Mumbai Government Medical College, the score, like now that is my analysis, ki score should be above 665 if you are considering general category. And depending on the year and the paper difficulty, the cutoff can even go higher up or lower down. And MBBS fees per to say in government colleges, it ranges between 2,000 to 2 lakh per year, while in private it will go from 10 lakh to 25 lakh per year depending on the location and affiliation of the college, of the private medical college. Now sharing my journey of NEET. So in 11th I was as confused as you all are. कि पता है साइंस लेना है, बट टू चूज बायो और मैथ आई वॉज स्टिल कन्फ्यूज. आई डिडंट नो व्हाट आई वांटेड टू परस्यू. सो इन 11th आई हैड PCMB मैथ्स भी रखा था, बट एज आई स्टार्टेड स्टडिंग बोथ बायो एंड मैथ, तो somewhere I realized that math was not as much of my forte as bio is, and plus I realized my strength and weakness and what I wanted, what my passion was for. So 11th में there was PCMB. After 11th I understood कि नहीं मतलब मेडिकल में जाना है, bio I want to pursue. So maths I left out, and I understood the seriousness of the NEET exam, the amount of dedication you have to give to it. So maths was left out. I stick to bio, and I was in an integrated class. So उसमें 12th का preparation is not that important for NEET. If for NEET your eligibility is above 75% in PCB subjects in 12th. So which is very easy. If you're preparing for NEET, you can easily score that much in your board exams. I myself prepared for my 12th board in the last 1 month. Timetable announced होने के बाद. But that was enough because that is not necessary. If if you're going for an entrance exam, so your main score and the seats given are based on your all India rank. Your 12th marks don't matter here. So that was one thing. And for me, I preferred offline lectures. Online lectures, COVID era tha to the online lectures. But for me, offline lectures, listening to teachers, asking doubts. And remember, if you are preparing for NEET, डाउट पूछना हमारा जन्म सिद्ध अधिकार है. यू कैन आस्क टीचर n नंबर ऑफ डाउट्स इंटरनेट है सॉल्व करने के लिए, बट आस्किंग डाउट्स गिव्स यू अ मच क्लियरर व्यू ऑफ द कॉन्सेप्ट एंड इट ऑल्सो हेल्प्स यू अंडरस्टैंड वेर यू आर गोइंग रॉन्ग. The second thing I would like to share is I had a mistake book. So after every exam, like there are test series that go on in integrated classes or online also they are available. So I had a mistake book maintained. So कुछ भी wrong जाता था, I would write that question. Why I went wrong? What did I consider? मतलब physics के में तो ऐसे calculation mistakes हो जाते थे. I skipped a step or something like that. In bio, there would be a theoretical knowledge which I didn't remember. So I would write it down and it helped me realize कि what are my strengths. Maybe in tension में गड़बड़ हो जाता है, तो calm रहना. So and even understanding concepts. So that helped me a lot. And second thing for NEET, I would like to say is practice n number of questions. Like by the end of 2 years, मेरे reference books खत्म हो गए थे practice करके. So that much amount of practice you need to keep your mind calm in that 3 hours 20 minutes which will decide your future. So that amount of practice is required. People start preparing for NEET in 6th, 8th, I have heard that, but I don't feel that is necessary because you have your extracurricular activity, self-growth in your school life, which is also important for your personality development. And the 2 years of 11th and 12th is, in my view, enough to prepare for NEET. But those 2 years, you should be like very dedicated, get rid of all the distraction, because once you get placed in the prime institute of the country as an MBBS student, it is worth it, the dedication of the 2 years. As for MBBS, it's opening gate, getting into the medical fraternity, which comes with its own wonders and surprises. There are total 19 subjects in MBBS, starting with ANAT, Biochem, Physiology, Pathology, Pharmacology and Microbiology for second year. 4 subjects hai, FMT, ComMed, Medicine, Surgery, Obs, Gynae. So there are like 19 subjects, which you'll get to know them. But it is wonderful. Once you get placed in a prime institute, it is worth the 2 years, 2 saal ki mehnat is worth it. Okay.
I have a question before you finish. Kishore bhai, just come here. See, this today's session is organized by 2 sanstha. One is KVO Seva Samaj, who has been into education, like promoting education, and the second sanstha is Matushri Maniben Sivji Devji Kanya Kelavani Fund. You heard about Kanya Kelavani Fund? This is a dream 50 years almost. 50 વર્ષ પહેલા એમનું ડ્રીમ હતું કે આપણા સંસ્થા એટલે આપણા સમાજમાં ફિમેલને આગળ લઈ જવા માટે જે એમને ફંડની જરૂર છે એને પ્રમોટ કરવા માટે અટકે નહીં. એન્ડ ટુડે ઇફ યુ રિયલાઇઝ, આઈ એમ શ્યોર યુ વિલ ગીવ અ સ્ટેન્ડિંગ ઓવેશન. કેન યુ બિલીવ all females are doctors here on the stage. Let's have a standing ovation and a round of applause for them. કે સંસ્થાએ જે વિચાર કર્યું હતું બંને સંસ્થાએ કે આપણે એમને પ્રમોટ કરવું છે. even I would like to please come in you can come on the center honey. કે આજે આપણી સંસ્થાએ જે વિચાર્યું હતું 50 વર્ષ પહેલા એ આજે સંસ્કાર દેખાય છે. ડોનર ટ્રસ્ટી સંજયભાઈ, please come. Sanjay Bhai is one of the donor trustee 50 years back, their fathers, and they have they are visionaries. કે આજે proud moment છે કે બધી કન્યાઓ આજે ડોક્ટર at top stage they are working and they have done the achievement. Thank you.
Thank you everyone.
And one more thing, I have a question for you. You said maths, but maths you dropped it at 11th, right? After 11th.
Half 11th.
So it is advisable to take maths right now, or straight away you take when you have decided for MBBS. Double stay,
If you're clear enough कि आंके PCB गन्नु है तो maths रखे जो point ना है, because maths would add up to the burden. You're already preparing for NEET. That's a huge syllabus to cover. So maths, if you are very clear, then keeping maths has no point.
Just one more thing to add on your this subject, on Bimal Bhai's question. Suppose if you don't get, you wish to become doctor, medical में entry capacity 100%. By chance, if you don't get it over there, and if you don't take maths, you are not eligible for BSc, MSc, anything. So that door's closed. So that is why maths should be taken, put less efforts, but take. This was the advice given when my daughter, Dr. Kinnari Kenya, was opting for what should I do. You get 50 marks, 40 marks, that's okay. M is not counted. PCB is going to be counted. But suppose by chance you don't get into medical, maths has to be there.
Like he's the father of a doctor, I am also father of a doctor. So, like to share our experience, taking 2 minutes of your time. It is very important because out of 100 KVO children appearing for NEET, 5 to 7 children get into MBBS or crack the NEET. Another 5 to 7 get into paramedics, including dentistry. So totally, if you see the success rate, I'm not trying to discourage you all, please, but the success rate is less than 20% of people getting into medics and paramedics. So with that, what my colleague Kishore Bhai just mentioned, don't opt out for maths, keep your options open in 11th and 12th, put less effort, put more effort in PCB. One more thing which I would like to add, after she completes possibly, that how many of you are from CBSE here? Raise your hand, CBSE. I find 6 hands totally from CBSE. Most of the papers which are set and people who are really serious of doing medicine need, in your 10th vacation has just begun or just about to begin. Take hold of 9th and 10th textbooks of CBSE for all these subjects, PCB, and use this 10th vacation to master the CBSE portion, because the examiners who are setting the NEET paper have inclination towards the CBSE model of setting up papers. So those children, out of 10 students appearing on CBSE, from CBSE, for NEET 5 crack it, but from ISC, SSC and other boards, much lesser children crack it. So if you have time and if you are strongly inclined towards medicine, take up the CBSE 9th and 10th textbooks, and this 3 months of vacation, April, May and June, whatever you all have, use it to understand how the things are written in those textbooks and how to study them. It will give you a much better chance of succeeding in your NEET exam. Thank you.
Yeah. So I think it was wonderful. Nidhi took us through a wonderful journey, and Nidhi is available post-lunch session also. So all of you who want to take more information about entrance exam and medical career can meet Nidhi in the post-lunch session also. Thank you so much, Nidhi. It was awesome, and we are very proud of you. Now we have, as I spoke about research, I have a wonderful friend who is going to speak about it. Dr. Kinjal Rambia, who is a dermat. She's also from St. GS Medical College and KM Hospital. And she has got more than 50 scientific publications in reputed journals, which are not just national, they are also international journals. So we have such people in KVO Samaj who have taken the name of Samaj internationally in academics. She is an assistant editor for various dermat journals, Indian as well as national, and a recipient of prestigious Rising Star Award from World Congress of Dermatology in Milan, Italy, 2019. So it's a real pleasure to have you here, Dr. Kinjal. And let's begin and let's hear from you. I'll request all the speakers to please stay in their time frame of like 6 to 7 minutes. Thank you.
Thank you, Dr. Hani, for the kind introduction. Okay. Maitre jo ગામ is Gundala અને Savra I am not in KVO. So you have like heard about NEET, and so I'm not going to talk about that. So when we want to choose a career, what do we I think my first slide is not there. Okay, so my first slide was medicine for life. Okay, so when choosing a career, you have to remember that you have to stay with it, stick with it for your entire life, most probably in ideal conditions. It should be like that. So, who should choose medicine and why should you choose medicine? So, it is a skill oriented course. Okay, you have lot of goals. Goals are to treat the patient, to provide good health to your family, friends, and other patients. It is highly demanding in terms of education. Like you have to, if you are taking medicine, be prepared to read every day for the rest of your life, because every day something new is coming. So you can't say I've finished my MBBS, now I'll not read, now I'll not touch the book. No, if you go to a doctor's place or a doctor's clinic, you will see a heap of books on the table or in the home. Okay, so books you cannot get away with. So if you are in love with books and if you can read books for your lifetime, you should choose medicine. Okay, then career acceleration. By that I mean that you will have a good career if you do MBBS, if you do PG, you will have a good career, you will gain lot of respect, you will do well in life, okay? But you have to remember that you have to work hard each day of your life. You cannot rest, you cannot have your own leisure time. So you have to be then responsible. So that responsibility will come with this course. And also we know that now there is a lot of demand of the healthcare sector. So there is a lot of growth in the healthcare sector. And so now we have patients which are coming from abroad, from other countries to get their treatment in India. So that is also there. So there's a lot of growth in this sector. Also, it is like a service to society. So if you're working, if you arrange camps, if you give back to society, you will feel nice. So that feeling of treating the patient, that feeling when the patient says, just by just looking at your face, my whole illness goes away. So that feeling is a nice feeling. So the ones who have that passion, you should go for this course. It is great for your personal growth. So when you see people joining MBBS, if you see a person who is in MBBS versus if you see someone who is in another course, you will see that the person who is doing MBBS is more groomed, more presentable, is not very irresponsible. So that responsibility, that personal growth comes automatically once you do MBBS, once you do PG, you will earn a lot of respect. So those who want this respectful life, yes, MBBS is a good course. And there are a lot of global opportunities. So in other countries also, nowadays people are moving, like in US, in UK, people are going and becoming doctors. So I think Nidhi has already mentioned about how to crack NEET. Now I would just like to highlight that what is the MBBS course. So MBBS course, the current course is slightly has changed from what we had done. So now the first year is for 13 months. So the total duration is 4.5 years of MBBS and 1 year of internship. So the phase one, the first year is of 13 months, where first month is foundation course. So now they play more, so the foundation, in the foundation course, they will teach you attitude, ethics, and counseling, how to communicate with the person, with the patient. So that is EdCom. So it is actually refining your soft skills. That is why I said that a person who is doing MBBS will be more polished than and groomed than any other person, because 1 month they will teach you only attitude, ethics, and communication skills. After that 1 month, your subjects will be anatomy, physiology, biochemistry. The second year will have 11 months where you have PSM. PSM is preventive and social medicine, pathology, pharmacology, and microbiology. Then the third year has 2 parts. In the first part, which is of 12 months, there is PSM, FMT, forensic medicine, ENT, ENT is ear, nose and throat, and ophthalmology. And in the second part, which is of 14 months, there is medicine, pediatrics, psychiatry, dermatology. So these are all medical fields: medicine, pediatrics, psychiatry, dermatology. And surgical fields are surgery, orthopedics, anesthesia, obstetrics, gynecology, and radiology. So Nidhi had mentioned there are 19 subjects. So these are the 19 subjects. Then now what is proposed is there will be a next exam. So it has not come on paper today, but it is, they are saying that for the batch 2022 who joined MBBS, so probably Nidhi's batch, when they pass out, they will get next exam. So next will be in 2 phases. It will have a MCQ based theory exam first, after the completion of the third part 2. After that, there will be 1 year of internship, and then there will be next 2, which will be the practical exam. So they say the scores of next will decide your PG entrance marks. So there will be no separate NEET, but next will only give the PG scores. So as earlier mentioned by Dr. Honey, there is, what is the scope? Suppose you want to do MBBS and PG, and then what? So you can either work in your private practice, or you can work as a job in a private or in a government hospital. You can be in academics, you can be a professor, a teacher in some medical college, or you can do research. Also in defense services, in railways, and these kind of institutes, they do need doctors. So they also call for interviews once in a while, and you can do a job with them. So these defense services, government hospitals, I said railways, these are all mostly these are all private, these institutions offer permanent jobs. So there are some perks of permanent jobs, like you get a lot of leaves, you get all paid leaves, you get vacations. So these perks are there in government jobs, which are permanent. Then suppose if you do your MBBS, you do your PG, but now you're not interested in seeing patients. So what you can do? You can become a hardcore researcher. So there are certain CROs so there are companies who assist in drug, like if there is a drug study or vaccine study going on, these companies will assist the investigators, the people who are doing the study, they will guide those people. So these are the CROs. So they also hire. Then there's something called as medical writer, which is in similar way. So these studies, when they are done, so if suppose I do the study, but I don't have the time to write everything, because writing a paper takes a huge amount of time. So there are professionals who will help. So medical writer. Then you can also become a scientist. There's a lot of scope abroad. Then healthcare informatics, healthcare statistics. Medical law is also a very upcoming subject, because nowadays there's a lot of legal issues. Legally, everybody wants to be in a defensive mode. People are more aware. So medical law is also an option. And there is some of my batchmates, they have also done civil services like UPSC and become IAS, IPS, IRS after doing MBBS also. So that is also an option after MBBS. If you're not liking medical field, you can just give UPSC exam and become an IAS officer, and that's it. Now, if you are planning for MBBS abroad, Then there are various options. There's USMLE, which is for US, PLAB, FRCS, FRCM, FRCSC Canada, FRACS, that is for Australia, FRCSH Hong Kong, Dubai entrance and Singapore entrance. I have not given any of these because I was sure that I wanted to do my education in India. But I do have, like I have done fellowships abroad and I have gained that experience, but I did not go formally to do residency over there. So what is the UG curriculum? I have already mentioned that now they want to train these doctors so that they are effectively able to communicate with the patients and relatives in a respectful manner. So some values and beliefs and confidentiality, privacy, that everything is taught in the first month of the foundation course. And they have called that as ATCOM, Attitude, Ethics, and Communication Module. So it is relevant in today's date because now we are seeing a lot of incidents where doctors are being hit by patients and all those things. So that is why, to avoid any such thing, this ATCOM module is specially introduced in the MBBS curriculum, and it is quite impactful. Now, post-graduation from this batch onwards, 2022, we don't know whether NEET PG will be there or next will be there. So this current year, NEET PG is there, but probably next year, next may come. So we don't know. Right now, NEET PG is there. And there's one INI CET, which is for AIIMS, JIPMER, and PGI. So AIIMS, JIPMER, PGI, you have to separately give INI CET. This is for today. But it is going to change, but we don't know which year it will change. Subjects, we've already seen that anatomy, physiology, biochemistry, and all the others.
We have 1 minute more to
Yes,
go.
I'm
Be
done.
now?
I'm done. So I would like, because I'm a dermatologist, I would like to tell about dermatology. Basically, I selected dermat. I had two likings. I wanted to take gynac or dermat. But then I wanted a good life, so I took dermat because I didn't want to get up at night and do deliveries of patients. So dermat is a very, very good and very lucrative 9 to 4. You can choose your time. You can choose that you don't want emergency. It is a very, very good.
You can say you have twins who are less than 1 year old.
Yeah.
Or you're still managing.
So I think that's a very important point because as you see, we are a panel of women experts here, but they are people who are also going to handle home, and that is where you need to have a work-life balance. And I think she's a perfect example of that. So it is not that if you go into medical career, you lose your work-life balance because that has been portrayed through years. You can choose. And that's how she made a career choice of dermat. And she's doing wonderful there.
Thank you. So what I wanted to tell you is, these are the subspecialties of dermat. That is not relevant for you at this stage. But I just want to tell you one thing. If you have passion for medicine, if you have passion for reading, if you have passion ki, no, I will be able to do this for the rest of my life, go for that passion, whatever it is, be it medicine or whatever. If I am even today, I am passionate about seeing patients. Even today, I'm passionate about, and I'm sure that even after 20 years, I will be passionate. So that is what will keep you motivating and keep going. Otherwise, if you're doing something which you don't like, which you're not passionate about, you will not be able to do it for a lot of your time or for your life. So that is why I tell you, this is medicine for life. So if you feel, then only you should take. Thank you.
Great. I think Dr. Kinjal has given us all the possible career options which are possible after medical, after MBBS also. So please don't feel the obstruction or feel the obstacle that, medical field is only about seeing patients. You can choose what you want to go ahead with. Thank you so much, Dr. Kinjal.
Thank you.
Yeah. So now we go for next speaker, who is Dr. Seema Vora. She's a senior physiotherapist. She has done her bachelor in physiotherapy from KJ Somaya, diploma in rehab from All India Institute of Physical Medicine and Rehabilitation, which is one of the topmost institute in the country. Certified McKenzie therapist having expertise in evaluating and treating spine-related issues, and she's an owner of Samyak Physiotherapy Clinic and has been practicing since last 14 years. So when we did we did a felicitation ceremony from Kutchi Medicos Association, and we have seen more and more students inclined towards physiotherapy. So I think this session will be the most important session. Of course, others are equally important, but yes, as a career option, physiotherapy is picking up in our community, and we'll have Dr. Seema post session also to clear all the doubts. So you can take photos in the meanwhile whenever, because she passes on real, authentic and important information. Over to you. Lovely.
Thank you, Dr. Honey, for a lovely introduction. So I'm going to talk about the, as she already mentioned, which is the fastest growing area of medicine, is the physiotherapy. It's the most important, first I would like to say it's the most important rehabilitative service needed in the community. What is physiotherapy? All must have heard about us during the COVID or the post-COVID time. But let me just tell you, it involves evaluating, diagnosing and treating a range of diseases, disorders and disability using physical means. When I say physical means, it is important that we don't treat pharmacologically, we don't treat surgically. We give a lot of exercises or modalities, a manual therapy which will get the patient out of the discomfort or disability what is happening to him. So, to become a physiotherapist, the job of the physiotherapist is very rewarding. It's not only rewarding in terms of money, which I say, but rewarding when you, a personal satisfaction what you get. When you can cure somebody from pain, it gives a different level of satisfaction. When you can make a person independent, when you can make the person mobile from the bed to the chair and get them back onto their legs, which they were doing it before, the satisfaction which you get is amazing. You know, no word can explain it. So the physiotherapists are basically involved into adding the quality of life to the patient and not only getting them back to the routine. So the job of the physiotherapist is very challenging. To become a physiotherapist, there are certain personal attributes which I would mention it. First and foremost, you must have an ability to install confidence and courage to the patient. Every medical profession would believe that if you can get the patient confidence, half of the battle is won there. The rest of the work will become very easy. And in a physiotherapist, there's a lot of physical stamina which is required. A physiotherapist are almost on the toes, you know. They are making the patient do the exercise along with them doing the exercises. So many a times we are involved with lifting the patient from the bed, getting them into the sitting and getting them into the walk. So it is a very physically demanding profession. And we should always have a patience and understanding of the people, you know, as the patient who are coming to us are into a lot of pain and agony, a lot of discomfort which they are going through it. So to understand them and then getting them to the help is needed. A good observational power is also needed, as the knowledge of the basic anatomy along with our certain evaluation tests which are there are enough to diagnose many of the conditions without undergoing unnecessary and costly investigation. So to become a good physiotherapist, you must have a proper knowledge about the anatomy. As I was taught in my first year, anatomy is our bread and butter. So if you get it, the subject thoroughly, then you can run for the life. You must have a good analytical and logical reasoning skills, as I mentioned, that will help us to evaluate a condition and getting to the diagnosis. As all medical profession need, a scientific reasoning and a problem-solving skill is also required. Excellent in communication and interpersonal skill is required. As physiotherapists, many a times work in a team with the other medical professions also. So you should know what the medical condition the patient is having and how you can help them with that medical condition. So, as I said, going through I don't have to go through the admission procedure as Dr. Nidhi has already done it. So it's 2 years eligibility with physics, chemistry, NEET examination is required. Just to mention about the physiotherapy, there are more than 438 colleges in India which are offering physiotherapy courses. Out of which there are only 36 colleges in Maharashtra, and out of which there are only 7 government colleges right now. So the last year cutoff where she mentioned about 600 and above for the MBBS, the last year cutoff to get into the physiotherapy in Maharashtra through the open category was between 380 to 410 score out of 720 marks, the NEET examination. So you must score something above 400 or 450 to get into the government colleges. As it's a 4 years course which includes a comprehensive study about basic subjects of medicine also are studied here, like anatomy, physiology, biochemistry, along with the basics of exercise therapy, the basics of working of the modalities, what are the diseases. So the medicine subject is also there. So along with that, we study a lot about the physiotherapy, the evaluation the physiotherapists do it, and getting into the management part. The fee structure for the government colleges goes from 27,000 to 75,000 per year, and in the private colleges, the fee structures varies somewhere between 1.5 to 6 lakhs per year. It's not as costly as into the medical, but still, the private colleges fees may range up to 6 lakhs a year. Definitely it does not stop here. After doing your bachelor's, there's a 2 years master's, which is right now in India, where the entrance is again through the PGCET. We have to give again an entrance test to get into the masters. And if you want to go abroad, there are various options available, like in US, Canada, and Australia, where the masters is between 11 months, that is a year to a 2 year course, and you can specialize into one of the area. I'll tell you which. Same way, the fee structures of the government colleges is between 25 to 75 for masters and 2 to 7 lakh. So the master, you can choose your a later field where you specialize into the musculoskeletal physiotherapist, where they are involved into musculoskeletal conditions, which means a joint pain, fracture cases, knee replacement cases, day-to-day routine activity. May the patient who are feeling the arthritis, sprains and all. So the musculoskeletal physiotherapist work here. You can specialize into neurosciences, where neurological conditions which are seen, like Parkinson's, stroke, spinal cord injury. So the adult physiotherapists specialized into neurosciences are involved with this, and there are a pediatric neuroscience physiotherapist who sees a lot of kids with the developmental delay issue, ADHD also. Definitely the OTs also have an upper hand in pediatric, but physiotherapists are also involved into getting them into the child achieving their milestone and getting back. A cardiovascular and a respiratory science physiotherapist, we must have all heard about them during the COVID and post-COVID time. They are the one who are involved with the chest-related and heart-related conditions like COPD, bypass surgery, and rehabilitation after that. Definitely, which is the upcoming field of physiotherapy, is sports physiotherapy. I would say there is no sports team which is complete, be it a national level team or an international level team or district level team, without a physiotherapist. So if you have a passion into the sports, and if you are keen into the medical profession, then you can choose sports physiotherapy also. Pediatric, and there is a community physiotherapy, where the community physiotherapists are again into, after choosing masters into community, there are two sub-masters here, a women's health and a geriatric physiotherapist. So the women's health physiotherapists are dealing with the conditions where a woman is facing from pre-pregnancy to the post-pregnancy and the weight loss plan. There are other certification courses which I've mentioned. There are small courses which ranges from a week to 1 month time, where you can specialize into a certified McKenzie therapist, which I am. So we really see a patient related to the back and neck pain and McKenzie. All these are small courses which can be done after you pursue your physiotherapy. I would mention the career opportunity as they've done. We can work in the rehab institute or a government hospital, where we are seeing the patients from the post-operative condition. Can even work in a private and a wellness clinic or a private home visit, which I am doing right now, where, as Dr. Honey mentioned, we can have a good work-life balance also. We can work for part-time and manage our house and other responsibility also. Even physiotherapists are placed in schools where they are involved with the child's milestone achievement. Many fitness centers and a sports training institute are also taking a physiotherapist as a part of their team. I would mention the industrial workplaces. Good industrial workplaces also are taking physiotherapists for the ergonomic advices. Just yesterday's Times of India also mentioned that sitting is becoming next to smoking. Many of us are involved with sitting work nowadays, and that has created a lot of issues with the back related, neck related, and other metabolic issues also. So the physiotherapists are the one who will tell you how you're supposed to sit, how much is the chair height should be there, what would be the correct posture of sitting, and how frequently you should get up. So many industrial workplaces are also taking physiotherapists as a part of their team. And finally, definitely you can enter into education and research as any medical profession. Thank you.
Wonderful, Dr. Seema. So one thing is fact that it's the most versatile field, physiotherapy and occupational therapy both, and medical field goes hand in hand with that. Like you cannot just discharge a patient without a physiotherapist advice. So it is that important today, and that is why it has opened various career options in today's world. So next in round we have Dr. Dhara Dedia Shah, who is a pediatric occupational therapist. She has done her bachelor's in occupational therapy from KM Hospital and has also done diploma in rehab from All India Institute of Physical Medicine and Rehabilitation. She is certified in sensory integration from University of Southern California. She is certified in brain gym, play therapy and aquatic therapy. I would really love to hear about these three things. And she is currently working at Theraplay at Opera House. Over to you, Dr. Dhara. I think the slides are ready for Dhara. Yeah, great. Thanks.
तो मायत्रेचो गाम गडचिसा and I'm married into Karagoka. So yeah. I'll talk about occupational therapy. So occupational therapy and physiotherapy in India are very overlapped as professionals. You know, like half of the things which I'm going to say has already been covered by Seema, but I would want to say a story like how I chose this profession. So basically, you know, when I was giving my CET, like 15-20 years back when I appeared for CET, the aim was always, I never wanted to do MBBS. The aim was always dentistry or physiotherapy. OT that I didn't even know of, you know, ke koro I. So unfortunately, I missed like my government seat of physiotherapy by just few, like maybe 100 ranks. So then, of course, I had an option of taking, I was eligible for BDS in a private college. But e-counseling round, 1 month later, the varovo, so I opted for occupational therapy. So I had already started college. So we had 1 month of only going to the hospital, doing rounds with the seniors there and helping. Within that 1 month, I realized that, okay, no, this is what I want to do, you know. And I was like, Mama, you know, I don't want to go in for dentistry or going in for a private college. I'm very much happy the kind of exposure that I'm getting at KM itself is so good that I pursue and I want to go ahead with this because it's something very new and nice. So that's how I've chosen OT, but I'm very glad that I'm here to help someone make OT a choice and not just like option I have no other option which happened with me, but I would say it's a very good choice. People can actually decide and take this as a profession by itself. So this is just a quote that I really came across recently and I really enjoyed reading it. It's by Alvin Toffler. The illiterate of the 21st century will not be those who cannot read or write, but those who cannot learn, unlearn, and relearn. So this is something that I relate to very, very, very highly because, you know, just education karela tho, bachelor's karela tho, master's karela tho, on patya like literally every day, almost like every year there is some degree that I want to learn, some certification course that I want to do. And that need of learning, you know, you want to be a learner all through your life has to be there in you, and you have to make sure that each and every person develops that, be whichever field you are in. You know, I'm sure panelists, everybody has those many number of courses or education list to them, you know, added to them. They have those many feathers in their hat. So that is one thing I think you have to always be a learner. You can never stop learning in your life. So occupational therapy is an allied health field, okay? It is occupational therapist is a part of the rehabilitation team, like a physiotherapist, occupational therapist, speech language pathologist. We all form, like the doctor, we all form a team and then we work towards a particular patient with a particular goal in mind. Okay, so what is rehabilitation? Rehabilitation is a process in which we help people who have suffered injury or illness to restore the skills and regain maximum self-independence possible. Now, what is an occupation? Like usually it goes like, yeah, I'm a doctor, I'm a surgeon, I'm a engineer. So occupation just does not go by the thing that you do, you know. Someone is a housewife. Housewife is also an occupation. For a child, playing also is an occupation. For a dada dadi, playing with their grandchildren is an occupation for them, or pursuing a hobby is an occupation. So occupation is something that any activity of daily living that you do which brings purpose to your life. So it includes things that we need to do, we want to do, and we are expected to do. So what is occupational therapy? So in occupational therapy is a profession in which we help people right from birth, like children, like babies who are just few days old, to old age, like geriatric population, old age population. We help each and every age span, okay? And how do we help them? We help them through the use of daily activities. Like physiotherapy, usually they give exercises. Like for example, someone has an orthopedic shoulder pain. So physiotherapist will tell you do this, haath upar niche karo, or you know, just strengthen your muscles. OT will be like, will do that, but along with that we'll have a meaningful activity. For example, if it's a housewife, just shoulder pain eye, so how will she take a burnie from the top shelf and keep down if she has a pain? So we will give activities, or we will help them adapt those activities so that she can perform her routine activities without any difficulty. So that's the differentiation between a physiotherapist and an occupational therapist. So these are the fields of which even Seema mentioned. Here in India, I would like to say we occupational therapists work like around 75 to 80% of occupational therapists are in the field of pediatrics. So we are working big time in the world field of pediatrics, you know, especially with children with autism, children with learning disorders, ADHD, developmental delays, you know, like Tare Zameen Par Fame jo learning disability, dyslexia. We are working a lot with all of these children, and currently I think in a classroom of maybe 25 or 30 kids, at least 5 kids need occupational therapy. This is the ratio that we are coming across in every school. So we are getting a lot of references from schools and in and around for everything. So basically pediatrics is the field. Of course, I have a lot of colleagues who are working with neurology, with ergonomics, with musculoskeletal, and frankly in India, OT ke physiotherapy, PT or OT, they just go hand in hand. We almost do the same work. So don't be disheartened if you don't get physiotherapy. You can always opt for occupational therapy, and you're almost going to be about doing the same work for sure. So these are just few images to show you how we help assist patients reach their daily activities, like make them independent in their daily activities, pursue hobbies which they are not able to do because of some difficulty that they have. And this is the with kids. So basically, if anybody enters my clinic, it's more of like a play area. And the play area is atla open nahi, pehla to atla nerva. But anybody who comes, we have like 50 to 70 swings, we have ball pool, we have climbing walls. So kids actually feel ke, okay, they're coming for a class and it's not like a therapy for them. So it's a very fun field that we are doing. Of course, it comes with its own, need to have a lot of patience. You need, like, I have kids who drooled over me, who cry, I have to clean their nosy, and madechti hai, but it's a lot of fun also along with it. So typical day at work, so basically we'll be doing a lot of assessments. There are a lot of regular sessions that we take. We have meetings with other professionals. We have meetings with the schools. We have meetings with the other doctors who are referring us, the kids, and to discuss the progress of the child or the patient. A lot of documentation, because reporting is, I think, very important in today's day and age, where you are proving what you're doing at every step in time, and follow-ups. So the educational pathway and the duration, the subjects covered, almost everything is at par with physiotherapy. Like it's exactly the same. There is no difference. Of course, subjects covered, like we all have all the medical subjects along with specific OT subjects in all 4 years. So fourth year is only OT subjects. First 3 years we have all the subjects that are covered in the MBBS course. Colleges in Maharashtra only 4. Okay, so there are other colleges in India, but in Maharashtra currently we only have 4. And why I'm saying it's an upcoming profession, because you can see the number of seats that are available out there. Every OT center is always in search for an occupational therapist, to an extent that some centers even have physiotherapists who are doing OT work for them. So it is a very upcoming, it actually is in India, it's there since 1950. Unfortunately, it's not come up to what it's supposed to be. But, you know, the need of OT in today's day and age is, I think, the topmost, because everybody wants to be independent in their life. It's an upcoming field. It's going to, please choose it as an as a profession, and just don't take it.
You are also designated doctors.
Yes, you are also. Yeah. So career opportunities, again, similar to physiotherapists. You can work in hospitals, you can be in a teaching field, work in schools, private clinics, home visits, and hospital administration. You can choose after as a master's thing. Skills, again, you know, you need to be very creative when you're working with children, because every child is different, every patient is different. So you need to be very creative. You need to have very good observation and analytical skills, patience, excellent communication skills, teamwork, and adaptability. So I would want to end my discussion with this. Doctor adds years to life, but rehabilitation team adds life to those years. And that's why we all are very proud that we can make a difference in your life.
Amazing.
Thank you. Thank you.
Amazing. I think you're doing a phenomenal job. Now, I really want to ask the audience, how many of you, after listening to this PT about physiotherapy and occupational therapy, actually want to pursue this? At least for now, how many of you are attracted towards this? Wonderful. We have we have many more hands coming up. So let me tell you, the future is really bright for this field. And because we are getting more and more diagnoses of autism, how many of you have seen an autistic child in a family or society? So many. So exactly, the number of this autistic child getting diagnosed, so many times they were not diagnosed previously, then they didn't get therapy because parents didn't know what to do actually. And so many times it is very depressing for the parents, for the couple. So I think from here, you also can propagate to those parents that occupational therapists are available, and as a career option, you all also can choose it and make a good future with this field. So now, when we have already spoken about two important fields, physiotherapy and occupational therapy, now let me present one more new field to you, which is pharmacology. So we have Pami Gala, who is Master in Clinical Pharmacy. She's a gold medalist. And right now, she's heading supply chain operations and clinical pharmacy at Tata 1mg and Tata Trust Small Animal Hospital. She has been associated with various renowned hospitals like Saifi, Wokhard, Hinduja, and HN Reliance. She is an assessor for NABH. And most important thing, she has recently met the philanthropist himself, Ratan Tata. So it is a proud moment for all of us that our KVO community has gone through all lengths and breadths of the country and met the most important people and are sitting with the most important people while they are making important decisions of their companies. So over to you, Parmi, now presenting your one more career option in pharmacy, clinical pharmacology.
Thank you, Honey, for the kind introduction. So I currently work with Tata 1mg for their hospital division, which is mainly Tata Hospital, which is at Parel, and a new upcoming hospital of Tata Trust, which is a veterinary hospital. It's a 200-bedded hospital. So what exactly is pharmacy? Okay, it's to do with medication. So when you go to any doctor, they will prescribe you a medication. So whatever goes into making that medication or marketing that medication or anything is, so each word that I mentioned there is a career in pharmacy. So researching new medication, you want to find out new options to treat a disease, manufacture those. Once you have researched, you have come up to a solution, you manufacture those, you package those, you label those. There are quality checks that to ensure that the medicine is safe for use outside. You market it, you tell the patients, you tell, there are research publications to tell the doctors what exactly the medication is, what are the side effects, adverse events, etc., and analyze its effects. So each word that I mentioned there is a big career opportunity in the pharma field. The route is same, 12th plus NEET. And here you have an option to either, you can enter through PCB or PCM. Both ways the entry is open. After 12th, there is an option for diploma in pharmacy, which is 2 years after 12th. There's a 4 years bachelor's course, which is in pharmacy, that is B.Pharm. And there is also a course which has been running for last 10 years, which NMIMS offers, is a pharma tech, which is a pharma plus MBA course, which is of 5 years. After, so if you want to enter from diploma to the bachelor's, you can do your 2 years diploma and then enter in the second year of B.Pharm. After you pursue 4 years of pharmacy, there are several options to pursue a career ahead. You can do your master's in pharmacy, which is of 2 years. You can do an MS, so Masters of Science, which means that you can choose to go abroad, US or UK, for which you'll have to give the GRE TOEFL exam. You can pursue an MBA. Now, each of the pharma companies or the hospitals, they have all these departments: HR, marketing, finance, pharmaceutics. So you could, and even Masters in Health Administration. So all these courses which you can do after a graduation in any of the science fields. So not restricted to pharma, something like a hospital management is something that you can enter through any field, and usually most of these big hospitals now, the entire medical admin team is, with these qualifications, a graduation in any of the medicine fields along with an MHA. Or you could opt to do a 6-month to 1-year course in clinical research or pharmacovigilance. And like Dr. Kinjal mentioned, you can enter a CRO, Clinical Research Organization. Once you have pursued your education, you could branch out into a retail industry, which is like a community pharmacy. You have a lot of e-pharmacy platforms now. That also comes into the retail part of it. You can enter a hospital. So my expertise lies in the hospital, where you can do patient care, you can get into quality, education, etc. I'll come back to this a little later. You can enter a pharma industry. So like I mentioned, you could get into research and development of a new medication, or you could get into manufacturing, packaging aspect of it, the quality aspect of the designing part of it. These are all the different options. Alternatively, you could get into education, like teach in a pharma college, get into research. A lot of insurance companies also recruit medical graduates, MBBS or BDS or pharma. Basically, the claims that need to be kind of passed, there is a scientific person who has to verify that whatever treatment you've gone through is rational and is justified, and whatever claim that you're claiming for is, you're eligible to get it. Medical tourism. India is one of the hub for medical tourism. So you get in patients here, they come here for treatment. At the same time, there are different tourism packages that you can kind of club it with, and of course business development. The subjects are pharmaceutics. It's basically how to make. So, you would make tablets, capsules, you would make cosmetics, injections, etc. Pharmacology is something to know what the medication does to your body and how your body reacts to the medication. Pharmacognosy is medication that you get from the plants. Chemistry, algebra, statistics. So this is something that I always cover each year. Do not opt out maths, not because your options of career are open, but I also feel that it's important that you continue with math all your life. It's an important subject that you would need throughout. At my position also right now, it's like it's a requirement. I'm more into auditing, analytics, supply chain, wherein now definitely AI has come in. But to use that AI also, you need the knowledge of what exactly you need from the AI, right? So I feel math is something that you should not. So besides the derivative and integration, which you may not use, but probability, statistics, analysis, something that you will require throughout. I'm not sure how much of it is used by the others, but I'm sure research you must be using a little bit of statistics, even for calculation. Simple dosing calculations, you need to understand how to calculate doses for a patient through, considering the weight, the age, etc. And the next subject is clinical pharmacy, which is basically use of medicine correctly and anatomy and physiology. I would want to talk a little bit more about clinical pharmacy, what I have done. So like how Dhara said, so we've done our MHCT together, and we did not get through, like her choice was not MBBS, but my choice was MBBS, and like her, even I got through pharmacy as a second option. That was not my first option. However, after doing my BPharm, my passion was to be with patients, to be in and around patients, and that is how I took up clinical pharmacy. Now, what I do as a clinical pharmacist is basically taking rounds with the clinicians in the ER, in the transplant, in the ICU, and discussing the medical plan with the doctors. Whether the medication that is prescribed is rational, whether it should be given, at what dose it should be given, considering the other organs of the body, say kidney function, the liver function, whether this dose is appropriate, what modifications should be done, what are the side effects, counseling the patient. Something, for example, a patient has tuberculosis and the treatment is for 6 months. It's important that the patient knows how important it is to adhere to that 6 months, the timing, what are the side effects. Suppose if you skip a dose, what needs to be done. This is basically, the routine. And besides that, most of the, like how colleges have accreditation, they have NAC accreditation, they ensure that whatever should be the standards of teaching, the may be infrastructure or the qualification of the teachers, etc., is all there in a school or a college. Similarly, a hospital also goes through an accreditation. It may be NABH for an Indian accreditation, or a JCI, which is an international body. There are standards to be followed. Similarly, here also, it's infrastructure, it's how well you're taking care of the infection control, how is your medication management process, because we need to understand when a patient enters a hospital, that patient is seen by 4 to 5 doctors. Reconciliation is very important. I am a patient, I have 5 medications that I'm already taking. At my admission, those 5 medications should be known to the doctor. I am seen by 5 different doctors. They give me 2 medicine each, to ensure that there is no interaction between those medications, to ensure that that treatment continues wherever I'm going shift. I go to the OT, I come out of the OT, I go to the ICU, I go to the ward. There is a continuation in the treatment, and that is exactly where we play a role here. Reconciliation, to ensure that medication management is correct at the discharge. Something which has been discontinued prior to your admission because of whatever condition that you have come in is restarted if it's essential to you. So this is all how it looks like. Just last 2 minutes, I did my master's. I entered into a very clinical field. I did my MBA, and later now I have branched out into operations as well. So what I'm trying to say is that you evolve in your career. When you begin, you may begin thinking that I want to become this. But throughout so it's been 14 years and I'm practicing, there are a lot of changes that have come in from the year 1 that I started till now. And the biggest role that played for me here was, like Dhara said, that learning, unlearning is very important. Secondly, for students, I don't know how practical it is in MBBS, but at least in pharma, I was able, so after every year, you have a vacation for 3 months. I took up internships every vacation in a different field of pharmacy, for me to understand after 4 years what I wanted to actually pursue. And that is how I came into this thing that there is a possibility for me to enter the hospital again, not through MBBS but through the pharma background, and that is how I took up clinical pharmacy. So math and internship is something, if you all can, take this home as my takeaway message, I think it'll change some decision in your life. Thank you.
Wonderful, Pami. So I think this is another one more example where you can make it big and still have a wonderful work-life balance. So medical field, as I told in the beginning also, is not that, you're just learning during your school days. You have to learn throughout your life, and you have to stay updated. And at the same time, the more you're updated, the better career you will get in future. So now next question, I'll ask the audience. From the quote, you guess who will come next. Never rush when you are about to brush. So who do you think is going to come next? Dentist. So we have none other than Dr. Priyal Gala, who has completed her BDS from Government Dental College and is currently working at Mahavir Dental Clinic under Lions Club Mulund, Manav Kalyan Kendra Dombivli, and Jeevan Jyot Charitable Trust Thane. She has been a part of a new startup for almost a year, Dent at Home, which provides dental treatment for old and bedridden patients at the comfort of their home. Has anyone heard about this before? Yeah, it's a wonderful startup where you can, because most of the time, for me also it was a challenge when I had to take my grandma to a dentist. So if you have something like this, some innovation like this, it is definitely going to be helpful. So dentistry is not about just becoming a doctor. You have good option of having your own startups also. So Dr. Priyal has proved that. So let's start and let's hear from her what dentistry is all about.
Thank you for the wonderful introduction, Dr. Honey. So, good afternoon, everyone, and a warm welcome to all the students present here who are looking forward to have a career in the field of medicine. And myself, Dr. Priyal Gala, I'm a consulting dentist from Gam Desalpur, and I'm here to give you some basic insights about dentistry. So, dentistry is the second most sought after branch in the field of medicine after MBBS. Now, let me tell you some facts about BDS. India has the second highest number of dentists in the world, with 2.7 lakhs registered with the Dental Council of India. Recently, WHO has recommended a ratio of 1:7,500 dentists to population to be present in the country, and very proudly, India has already achieved 1:5,000 dentists to population in the year 2020. So now, what is dentistry all about? Let me give you a few great reasons to be a dentist. So first is the service to the society. Obviously, being a doctor, you are able to serve people, help them maintain their oral health, and design in the most precious curve, the beautiful smile, and also improve their quality of life. Secondly, being a dentist, unlike being branches of pure medicine, you need not have to cater to any kind of emergencies. So it gives you really a good work-life balance, which everybody else has almost mentioned, which is very much essential for female candidates especially. Third is education and disease detection. So there are many diseases which give first oral signs. So as a dentist, sometimes you might be the first person to find out about certain diseases like certain cancers or certain cardiovascular conditions. Moving ahead, that branch is completely technology driven with new advancements coming almost every now and then. And to proceed ahead, you need to get knowledge about everything every day so that you can just work at your best. Next is being creative or bringing out the artist in you. So it is rightly said that the dentist is not just a dentist alone, but it is an amalgamation of three different professions. A doctor, an engineer, and an artist make up a dentist. Obviously, a doctor because diagnosis always comes first. An engineer because you need to apply all your basic engineering physics, right from giving a simple crown to the patient or giving braces or doing implants. So like what torque is needed, what force you need to apply. So you are applying all of those basic physics as well being a dentist. And lastly and most important, an artist as well, because you need to have a great aesthetic sense so that you can design in a very beautiful smile for every patient, and you want every patient to look at its best. Lastly, there is a great potential for success in the branch because of increasing awareness and a push towards modernity, and the branch is actually evolving with a great scope ahead. Moving ahead to the eligibility and entrance, the eligibility criteria is same, that you need to clear your 11th and 12th with physics, chemistry and biology as your core subjects. And the other details about the NEET exam have been already mentioned, so I'll not go into the details of the same. Moving to the cutoffs and list of colleges, the qualifying mark for a general category candidate is 50th percentile of the topper's score, and for around dentistry, you need to have almost a score of around 500 plus for a 500 plus in NEET to be eligible for getting admissions to BDS, for about total of 26,949 seats available across 420 dental colleges in India. Talking about colleges of Maharashtra, we have 4 government dental colleges in Maharashtra, out of which 2 are in Mumbai, which is Government Dental College Mumbai and Naya Dental, and 2 out of Mumbai are GDC Nagpur and GDC Aurangabad. And rest, we have 35 private colleges in Maharashtra. Now telling you about the course, BDS is a 5-year course which includes 4 years of training and 1 year of compulsory rotatory internship. Now another advantage doing BDS is that apart from learning all the dental subjects in detail, you are also learning all the medical subjects, right from anatomy, physiology, biochemistry, pathology, microbiology, pharmacology, general medicine and general surgery as well. Obviously, because any patient coming to you for a dental treatment might have any of those medical conditions or medical history. So while treating them, you need to have a knowledge of all of this and the condition needs to be taken care of. So it's worth studying and worth applying it. Now I'll just give you some insights about the career scope along with the corresponding challenges which each of these have. So first and the most common option which everybody chooses after completing their BDS is to go for a post-graduation or a master's degree, which is again a 3-year course, which is again filled by a NEET PG examination. So I would say if you want to be that dentist who wants to treat even the most complicated case with a superb finishing, then MDS is an option you should opt for. Just make sure that you given your full concentration to preparing for your NEET PG and try to make sure that you can get admission in a clinical, you can get a clinical seat from a good government college. Failing to do so, if you may afford, you can also do it from a private college, and just put in all your efforts practicing those years and do not waste time there. So MDS really gives you a polishing curve in your life, and a good clinician will easily make up to 3 to 5 lakhs a month. And there are 9 specialties in dentistry, as I've already listed. You can just go through all of them, and if there is any doubt, we can always come up on it later. So I just missed out on the challenges here. So the only challenge doing MDS is that in case if you're doing it from a private college, then you'll turn up with having some high educational costs which need to be taken care of. And the high cost is not just in terms of fees, but also about your books, the equipments and the materials required for all the dental procedures. Next option is that if you are good at clinics but still don't want to study ahead after your BDS, then putting up your private practice is also a good option. But obviously, putting up a private practice, the major challenge is the high initial setup cost, which comes as a great investment for you in the initial phase of life. But still, it is a good option. I would suggest once you are opening your own private practice, be proactive in doing promotion of your clinic and just be sincere enough and hardworking, and you'll just earn decently once you're set. Next option which you can go for is teaching by applying in any dental college as a professor or a lecturer or an assistant or associate professor. Again, the challenge here is that there are limited job opportunities available in the field of teaching. Plus, it is mostly limited for those who have already done their MDS or for postgraduate students only, so that they can teach. Next option is you can even opt for a government or a private job, maybe in any hospitals or trusts or associations. Again, the same challenges here, that there are limited opportunities for a government job as far as a complete dental setup is considered, because you will not get any place where each and every treatment is being done in a government setup. And but obviously the pay scale and other benefits of a government job are always there. Second is, if you are going for a private job, you will not be in a position like initially when you have joined, then you'll have to bear that phase when you are not earning decent enough in the first few years. Maybe in the initial practice when you're working as a trainee under some dentist, you might hardly earn 5 to 10K a month, and you will just get to do all the basic cases. But yes, once you gain experience, your pay scale will also gradually increase. So you really need that patience being into the profession. Next option is to go abroad. You can go abroad and just go for your masters, or you can even go for some other fields like masters in hospitality administration or masters in public health. The details of which are already mentioned by Dr. Kinjal. She had mentioned the exams which are required for the different countries. So the challenge is only that whatever country you are choosing, you have to just clear the licensure exam for that. Next, you can also go in for some alternative career options like in public health sector, like go for research related to oral cancer maybe, or you can go up in some pharmaceutical industry and help in designing of the dental products and dental materials. You can also solve great mysteries going into forensic dentistry. And even if you are not if you're not interested in working with patients, then you can opt for something like MBA. And one of the very good option is doing MBA in marketing if you have really good communication skills. And the course is of 2 years, and after completing that, you can easily get a job in any private company, manufacturing companies which design products for the dentals. And in fact, in those cases, as a MBA, as a dentist, you are the preferred choice to be hired. You can also opt in for some government services like UPSC, or go in for short service commission in Indian Army and just serve the nation. And lastly, the newer startups, which already Dr. Honey mentioned. So luckily, I was also part of one of the startup, Dent at Home. It started in COVID actually. So it was made to cater to all the old bedridden patients whom you cannot take out to a dentist. So we just saw actually, it was started by one of my seniors, there are many old patients who are bedridden, and many of the medical conditions, they start when you are not able to get that good amount of food. So it starts from the oral cavity. So why not help these patients also cater to their dental needs? So this was how it was started. We had designed our own portable setup. There were some Chinese machines available. We modified it. We had one, like my colleague's father was an engineer from an IIT, so he helped us in designing those machines which we could carry out. And it is still going on, and almost like daily, we treat almost 5 patients daily doing home visits. So it's also one of the wonderful options.
Amazing.
So that was all about dentistry. And lastly, I would just tell you that whatever options you choose, they are all going to be successful, provided you like them. And then after you are choosing it, you just treat it with utmost sincerity and honesty, and definitely you'll be successful.
Great job, Dr. Priyal. I think it was amazing to hear from you about everything about dentistry, and it's nice to know that we can fix and we can design our own smiles by you. Thank you so much. And now we move to our next specialty. But before that, I want to ask you one thing. How many of you have relatives in USA? So you know US people come to India only for 2 things. One is to attend family wedding, and second is to take dental treatment. They trust Indian doctors so much, and there is a long waiting period out there that people actually come to India. First thing is of course cost, but second thing is expertise. There's a great expertise in Asian doctors, I would say, and you'll see more of Asian doctors in US also. And a lot of US people come to India for their dental treatment. It's in great demand. So of course, it's a great career option. Only thing is you have to meet right people at the right time, and you will flourish in the career. So next thing I want to ask you, how many of you take homeopathy treatment right from childhood? Oh, we have so many of you. And how many of you aspire to be a homeopathy doctor from day one? Lovely. So we have here Dr. Kinnari Kenya. I think we are living in an era where we have to have a complete clarity. And if we have a clarity that we want to become a homeopathy doctor, I think it's worthwhile considering what are the demands of the patient today. And I think Dr. Kinnari Kenya can actually align the path of homeopathy, the career options, and what actually homeopathy is. So Let us hear patiently to Dr. Kinnari Kenya.
So thank you, Honey, for the great introduction. And like she asked you all, how many of you all are taking homeopathy from childhood? So I am also one such person. My own grandfather is a homeopath, and I chose homeopathy just because I had not taken any allopathic medication throughout my childhood, and I didn't want to practice that. So it did not choose me, I chose homeopathy, unlike most of the times that it happens that people don't get into MBBS. Ab kya karna hai? We'll go for homeopathy. No, don't do that. Please choose homeopathy by yourself, because now with the Ayush ministry coming up from Mr. Narendra Modi and his colleagues, we are having a lot of opportunities that will come up soon. So let's see. And so yeah, homeopathy is the second largest system of medicine that is being practiced after allopathy, and it is also accepted. Now this has originated in Germany, but now in abroad homeopathy is not so widely practiced. It is more often practiced in India, and especially Mumbai and Kolkata. The best place for learning homeopathy is definitely Kolkata, but Mumbai has become the hub where more practitioners are seen. And like nowadays we talk about holistic healthcare, which includes both your physical, mental, emotional needs, and therefore homeopathy is one of the biggest system where holistic healthcare is taken care of. Now, many of the people have questions that why homeopathy could not flourish so many years. That's because there were certain misconceptions, and there are some which are still not cleared up. But sooner and gradually we got many changes in that system, and since the last 10 to 15 years these misconceptions have been cleared. And COVID was one time where arsenic album was widely given and widely people have been taken in rampantly, and that's where homeopathy got the biggest recognition. So now all the people ask me, homeopathy made disease mein halai karo? Yes, homeopathy almost many diseases mein halati, right from your acute cold, cough, fever to all the autoimmune diseases. And with the rise of autoimmune diseases now, homeopathy has opened its greatest scope to everything. But jada scope where ada limitations range, and we must take that in consideration first. Sauthi pella, homeopathy is a non-surgical branch, એટલે surgery is not possible. Along with that, अमुक surgical cases में जिनमें खाली surgery option आए, homeopathy cannot help you there. And stage 4 and stage 5 diseases along with emergency cases are not the scope of homeopathy. Now, entrance exam. BHMS is the main course, and entrance exam is NEET, where we have to study the same things as mentioned by Nidhi, and you need 50 percentile marks in your NEET PG, anything ranging from 360 to as much as you can go are fine for taking admission in BHMS. At present, there is no exit exam for the same. But in future, definitely an exit exam will come, maybe 10 years down the line. Now, BHMS course, that is Bachelor of Homeopathic Medicine and Surgery. Most of you all will have a question that why is it called Bachelor of Homeopathic Medicine and Surgery, even when it's a non-surgical branch. Surgery is definitely taught in the Homeopathic Medical College because we have to take the patient into consideration first, and if the patient requires surgery, please do not keep him on medical treatment. We have to refer at the right time, and that's why surgery is important. Now this course is 4 years and 6 months, that is 4.5 years with 1 year of college internship. And the subjects covered are almost same as the MBBS course. The only thing that differs here is that pharmacology is not taught, but it has 4 other homeopathic subjects. That is, that covers philosophy and the way of using the remedies and many other details. Now fees for this is around 1.5 to 2 lakh per year in a semi-government college. In private colleges, it can go up to 6 to 7 lakhs very easily. Now, after BHMS, there is post-graduation available. Now, post-graduation can be in three basic dimensions. First is MD in homeopathy, where we have 7 subjects and there are 3 clinical subjects included, that is medicine, pediatrics and psychiatry. Medicine includes all the different diseases and systems that are available. Pediatrics and psychiatry are limited to that domain. And soon to be added, that is from next year, is dermatology and community medicine. Community medicine will open doors to careers in primary health care and preventive medicine. Now, along with that, there are many people who don't want to do MD because it's a 3-year long course. They can opt for postgraduate diploma and degree courses. Now, diploma and degree courses are available in emergency medicine, psychology, nutrition, cosmetology, MBA in healthcare, and many, many more, as all of them have mentioned that if you don't want to practice homeopathy, you can get into something. And there is even a bridge course for all those who feel that homeopathy is not our capacity, because homeopathy requires a lot of skill set. You can always go for a bridge course or CCMP, but there is no guarantee that this course will last for a longer time. There are talks that this course may shut down soon. Now, why should you do MD? Why is MD important? With BHMS, your career options are very limited. You majorly can get into only practice. Now, if this was 10 years previous, BHMS had a big scope because they used to allow people everywhere. Now, MD has become a criteria for many things, such as academic jobs, research jobs, because research is a subject taught in PG. Specialization in homeopathy after doing clinical subjects. There are many people who practice only homeopathic psychiatry, only homeopathic pediatrics, and there are even people who are doing courses from various institutions and practicing dermatology and rheumatology also. Now, corporate jobs. Corporate jobs are available in most of the bigger companies like Samsung, ABN AMRO, etc., where you have a part-time job and you can practice as a homeopathic physician out there. And government jobs are definitely available. They are even available in the government medical colleges, like KM Hospital has Dr. Farooq Master, who has opened his OPD 3-4 years back, and he is definitely doing great in homeopathy while integrating with the modern medicine. Now, entrance exam for MD, it is APGET, that is an all India test, and the minimum requirement for this is more than 50 percentile and more than 60% marks in the final year of BHMS. MD has 3 years course, and this is divided into 2 parts, where in the first part you are taught things like research methodology and teaching fundamentals, along with the subject that you have selected. In part 2, it's only the selected subject, and a thesis or a dissertation with proper research has to be submitted. Only then you get an MD degree. The fees varies from around 2 to 5 lakhs per part in a government and semi-government colleges. In private colleges, much higher. And in government colleges, stipend is also provided around 35 to 40,000. Now, most important, where everybody has their eyes on, is income. With homeopathic practice, there is no limit to how much you can earn. It all depends on your own skill set, your own experience. Now, what is skill set? So skill, most important skill is homeopathy. In homeopathy is history taking. If all of you have taken homeopathic medicine here, if some of you would have, then first time we went to the doctor, it took us 35 to 40 minutes easily. Why? That's because homeopathy requires a lot of history. And this history is not an easy cup of tea for everybody to take. It requires lot of questioning abilities and even perception, and therefore this has no limit, and it takes 3 to 5 years, which is an incubation period, to set up a good practice. As in, when you grow, the income source increases. Now, academic job is basically a teaching job in a college, in a homeopathic medical college, which varies from 30,000 to 1 lakh rupees a month, depending upon what position you are in. A corporate job. So this is a part-time job. Corporate job means a bank would hire you probably for 2 hours, where you can, practice homeopathy, see the employees of the bank, and that's how they start paying you accordingly. For a research job, it is around 25,000 to 1 lakh, depends on the nature of research you are doing. If it's a small paper presentation, it will charge you lesser, and if it's a big thesis dissertation kind of thing, then it would be more. Medical officers. Most of the medical officers in the hospitals here are BHMS graduates, but this is a little different because you will not be practicing homeopathy if you get into this. It will purely be an allopathic practice, and a diploma in emergency medicine is always good to support this. And lastly, Honey told me that we have to talk about work-life balance. With homeopathy, work-life balance is a very, very easy thing to do because it depends on you. What time you want to work is your choice. You don't have to attend to emergencies unless it's from a family and somebody calls you, ke bhai, edo thyo aya na, you have to come. So definitely work-life balance is very easy to manage, and if you have any questions, we can definitely go ahead later. Thank you.
Thank you so much, Kinnari. She is pursuing her MD in homeopathy presently and is also practicing at Arihant Clinic, Sayan Manav Seva Sangh and CVOD Medical Center, Ghatkopar. So she's available for the treatment, and of course right now she's available for the guidance post-lunch session also. Thank you so much, Kinnari. So I want to ask all the students out here, what is one thing you have understood amongst all of us, or amongst all the field? What is one thing that is very commonly a skill that is required? Patience and communication. I think language is a very important thing because you are dealing with a human. And so many times I see that in our Samaj also, people don't speak Kachhi at home. They don't read Patrika. They don't know how to read Gujarati. So I think we have to start doing that. If you want to be successful in medical practice, you should be able to speak Kachhi, Gujarati, Marathi, Hindi, and should be able to pick up new languages also. I was in Mizoram for 3 years. I can speak Mizo fluently like any other Mizo. Today I practice in Wokhad, where I see a lot of patients from Gulf, and I can speak Arabic with them. That helps me to grow very fast in my practice. So I would request all the parents out here to see to it that you can teach how to read Gujarati also, how to speak Gujarati. Please inculcate the habit of reading Patrika, and at the same time to speak Kachhi at home. This would help all your students to flourish in whatever career they choose, but 100% in medical field. Second thing is very important that I feel in the post-lunch session, 1:1 session which we have, I think the students should meet these professionals for sure, but the parents should also meet the parents of the doctors. Like Sanjay uncle is there, Vimal uncle is there, Ila ma'am is there. They all have doctor child in the family. You should also understand what your child goes through, what challenges they have seen as a parent, which you can learn from there. So I request the parents to also meet the parents when the students are meeting the professional, so that you can be very empathic towards your child when they are preparing for these entrances, their real challenges, and also when they are establishing in their career. So be very supportive to them, and you can get very good idea from all these parents who are out here. And now we come with the last speaker, who is going to speak about our own science. We heard about the science, modern medicine. We heard about the science from Germany, homeopathy. But now we are going to hear about the science of life. 5,000 years back, which was started, that is Ayurveda. And we have none other than Dr. Manali Visaria, who has completed her BMS from D.Y. Patil School of Ayurveda. She has also completed her MD Ayurveda from YMT Ayurvedic College. And she is also Ayurvedic consultant at CVOD Medical Center and Arif Ayu Private Limited. She is a founder of Dr. Manali Ayurveda, manufacturing Ayurvedic herbal soaps. I think we should hear more about that. And she has won the first prize for Best Ayurvedic Research Paper Presentation at 3 different seminars held at national level. Kudos to you, amazing work, Manali. Let's hear from her about Ayurveda.
થેન્ક યુ ડૉક્ટર હની સાવલા મળે કે જય જિનેન્દ્ર ના અરે પહેલો પ્રશ્ન એટલે આયુર્વેદ કરો એટલે હા ઓકે ઓકે એટલે મીન્સ વોટ ઇઝ આયુર્વેદ ઇટ ઇઝ અ ટ્રેડિશનલ સિસ્ટમ ઓફ મેડિસિન ઇન વિચ અ હેલ્ધી ઇન્ડિવિજ્યુઅલ ઇફ he or she wants to maintain its health or a disease individual હોંકે ટ્રીટ કરવું હોય then you can treat with the help of plants, minerals or natural treatment like Panchkarma therapies. Entrance for BAMS, that is Bachelor of Ayurvedic Medicine and Surgery, is NEET, which was well explained by Nidhi Maru. Same hai, but colleges for Ayurvedic colleges, there are private colleges, government colleges and aided colleges. Now for admission in for BAMS, Sanskrit is not compulsory, you should know before only. It is taught as a as a subject in the first year. So BAMS, it is 4.5-year course including and 1-year internship. In the first year, subjects are mainly Grantha Jokove, that is Charak Samvita, Ashtang Hruday, that, and Sanskrit is as a subject. You written paper and viva, everything can be done in English. It is not necessary that you should write everything in Sanskrit only. Then there are subjects having Ayurvedic and modern aspect both. That anatomy, physiology, then Ayurvedic pharmaceuticals. Then there is a branch which teaches about herbal plants. Then there is a branch of pathology. Then there is holistic health related subject in which yoga is also included. Then there is medicine, toxicology, general surgery, pediatrics, gynec, obs, ENT, optel. And in final year, there is a research and okay. Then there is in final year there is a subject that is research methodology and medical statistics. In that it is totally in English. In that the research, how it is conducted currently, that is taught, and how medical statistics you can apply in research, this is also taught. Then after BMS, there is post-graduation in MD and MS Ayurved, that is for 3 years. Then you can do MPH, diploma and fellowship courses. But more weightage is given to MD and MS Ayurved. And about fellowship courses, these differ as per university, means uska duration and timing. Then after MD or MS Ayurved, one can do PhD in Ayurveda. Then after graduation or post-graduation, what one can do, that is you can practice Ayurveda and allopathy both. But I would suggest if you are taking BAMS as a subject for your career, then you should practice Ayurveda. Why? We'll discuss that further. First is government jobs. In government jobs, research-related jobs are present, and without research-related jobs are also present. In research-related jobs, they will give you the job related to research in Ayurveda. So for that, knowledge of Ayurveda is very important. And for research-related jobs, more weightage is given to the one who do MD or MS Ayurveda or PhD in Ayurveda. Then Ayurvedic pharma companies also you can apply, but mainly for production and in case of research associate. In these cases, MD in Ayurvedic pharmaceuticals is very much necessary, and after BMS or in any other MD or MS degree, if they want to do something in pharma companies, then they can go as a content writer. Now this, as per Gazette notification of Government of India, dated 20th November 2020. Ayurvedic doctors who possess MS Ayurved degrees, they can perform surgeries only in cases which hands-on training is given during their post-graduation. No any other surgeries. And in MS Ayurved, we don't have brain surgeries or cardiac surgeries. Then in case of lectureship or for professor, minimum MD or MS or PhD Ayurveda is mandatory. Last is the business ideas if you become an Ayurvedic doctor. See, first one is all three. These can be done after BMS also and after post-graduation also. But if you want to do MD in medicine, Ayurvedic medicine, you want to do business in Ayurvedic medicine, then most preferred is MD Ayurved pharmaceuticals. Then if for Panchkarma, instruments or equipments, then most preferred is MD in Panchkarma. Then for herbal cultivation, MD Dravyagun, it is a branch in which all medicinal plants are taught. Okay. Last is thank you. One thing I wanted to say, the Hani Savla said that about manufacturing of herbal soaps. I myself is in MD Ayurved Pharmaceuticals. I have done MD in Ayurved Pharmaceuticals. I'll talk in એટલે મુજો કી વો એટલે આવો ને MD કઈ જે પોએ ઈ ચાલુ ક્યો હૈતે ને કે આ લોક કહી સકોતા MD કઈથી પહેલા પણ કહી દો અમે બેસિક ही વે એટલે કઈ ડ્રગ ને કઈ મિનરલ કે કઈ ફોર્મ में आके यूज करनु वे એટલે બેસિક है अगर અહીં કેસર ગણોતા કેસર के અહીં डायरेक्टली एक केसर કઈ પણ એક मेडिसिन में वजो तो जो यूज अलग थी है अने हों के अगर અહીં બે मेडिसिन સાથે अगर અહીં મિક્સ કરીને કહોતા તો હોંજો વાપરાશ અલગ है એટલે હરેક કે અહીં ન ચ કે કેસર से एक्ने में यूज थींदो पण कैते थींदो હું મારે આકે MD કહીને સમજ में पे थैंक यू
So, Dr. Manali, I think that was wonderful. How is your experience as an Ayurvedic practitioner presently?
Presently,
What is the response of people? I want to know.
See, I practice pure Ayurvedic only. With Panchkarma, without Panchkarma, both I treat. Then basically, towards me, patient come for Ayurvedic treatment only.
I think that is picking up in today's world. People want to go for Ayurvedic treatment directly, and that is why there are chances that this field is going to flourish more, and we'll have more and more Ayurvedic doctors practicing in near future. Maybe in Mumbai you'll not see so much, but once you go to South India, Kerala, you will see the real difference in practicing. Yeah.
Under Ayush, there are many institutes which they have opened.
Yeah, under Ayush, absolutely. They have opened up many, many more institutes. Sanjay uncle wants to add something.
Huh? No, currently there is currently no correlation between them. Ayurveda is different and this is different. એટલે means when I started making herbal soaps from I think 2022. એટલે એકદમ means ચૂન એકદમ કોર में વને વનું ના હોય તે. Now currently if I see many Korean medicine પણ વેતા ને होंजो पण कोरिलेशन करने हमें कहता बट कोरियन मेडिसिन होंजो कॉन्सेप्ट अलग है एंड दिस आयुर्वेदिक मेडिसिन जो कॉन्सेप्ट अलग है इन आयुर्वेदिक मेडिसिन यू हैव प्लांट्स then you can use minerals also but minerals they are not used like if you take gold then it is direct gold when એને apply કરી જો હોય તે ના there's a technique called bhasma preparation ઉમયથી है so both are different.
Great. I think it was amazing, Dr. Manali. You have introduced us to a totally new field. And I would like to thank all the speakers who have completely justified. Ila ma'am wants to add something. 1 second.
In fact, in the NEP 2020, Indian knowledge systems, that is the traditional systems which have been century old, are all being revived. And Ayurveda has got that, you can say that status. So that is why under the Ayush, there are so many Ayurveda, all India hospitals like AIIMS, Even All India Institute of Ayurveda is also set up.
I think all the speakers have done a wonderful job of giving you a great knowledge about the changing era of medical field. Please don't go by the old concept that medical field is a field where you have to just study all your life. I think any professional course today is demanding being updated. So you go in medical field or any other field, may it be CA, engineering, whatever, even entrepreneurship, you need to be updated. So medical is no exception. So you can have a good work-life balance, you can have a good family life. We all are example of that. So please do not hesitate to choose medical science as a career option. And also being part of Kutchi Medicos Association and the mentorship program which we run, we'll be happy to help you to settle down in the practice, to give you mentorship when you're working actually, and to also provide all the guidance when you want to study abroad. So make sure that you stay in touch with us, and we can, of course, together work out more and more medical students in our community. You want to add something? Yeah.
Hello. Please excuse me for my throat. I have a bad throat and an infection. I just wanted to check with you guys, post-lunch, whom should we meet for more details on veterinary studies, science and animals?
So I think Parmi and I can take that up. We will speak to you about that, because she's working in the animal hospital also. She's the right person.
Right.
And of course, we'll give you other contacts also.
Perfect. That should be great. Thank you so much.
Just 1 minute. See, there would be many professionals and many professions which probably are not covered. It's not possible. So if at all there are any specific questions that you have, you can always approach us. We will connect you with the right person. Okay, now just at the... Is he? Jitinaj? You can say the vote of thanks.
I know everybody will be now very hungry for today's, but I am confident you must have got deepest knowledge of all the sessions we have today. And with that, I just want to finish my vote of thanks in brief vote of thanks. First of all, I thanks all of our panelists who has given their valuable time and knowledge and share all their insights with us to take our decisions, help you to take your decisions. Then I'll thanks the all the committee members and office bearers of both the institution. Thanks to volunteer teams who have done their job very good, and they have planned 2 days this seminar. And
Just 1 minute. Can we have little patience? Can we have little patience? I think this feeling of gratitude should be there in all of us. Yes or no? So can we have little patience while he is expressing his thanks to the different people who have contributed? Let's all support him.
Thank you, Ilaben. Then thanks to the management of the Thanak Wasim Mahajan to allot this space for conducting this seminar and workshop. Thanks to sound team. Thanks to the photography team, Hitel Photograph, for covering this entire event with photos and videos. We might put link of this video upload on YouTube. The link will come in newspaper, both the website. Thanks to the caterers who has served foods since morning, Atul Bhai, and decorators for managing all these chairs and everything. And thanks to one and all who have helped us directly or indirectly to take this event at this stage. Thank you all of, and nonetheless, thanks to all of you, students and parents who have come here, nicely attended this workshop and enjoyed everything. Thank you.
So just the last minute, we need to present our memento to the esteemed doctor panel who are with us. And can I invite whoever are present from the two teams Yeah. You all can come. Please come. It's an honor to respect the doctors who have worked tirelessly during the COVID. Let's all applaud each one of them. Dr. Lalan, Sanjay Bhai.
એક લાસ્ટ વિનંતી છે, એક વખત જોરથી તાળીઓ પાડજો, કારણ કે અમે કેટરર્સ વાળાને છે ને એક ઇન્ડિકેશન આપ્યું છે, અહીંયાથી જ્યારે જોરથી સંભળાશે ને ત્યારે કાઉન્ટર ચાલુ કરશે. લેટ્સ હેવ અ રાઉન્ડ ઓફ એપ્લોઝ ફોર એવરીવન. યસ.